And we should now be live.
Good morning, everyone. I'm Sage Turner, Chair of the Asheville Regional Housing Consortium. I'd like to welcome you to the February 2nd meeting. This meeting will be largely led by Baker Tilly as we discuss the upcoming HOME-ARP plan. We're streaming live on a virtual engagement hub, which is accessible through the virtual engagement hub link on the front page of the city's website. We also have an option for the public to listen live, and you can do so by calling in at 855-925-2801, and you'll enter the meeting code 8763. For those of you out there listening and joining us today, welcome. I'm going to go through a brief introduction, and when I call your name, if you could just give us like a hello, I'm here. We'll announce board members and staff leadership. So if you could come off mute as I say your name. Let's see, I believe Rob and Merrill cannot join us today. Karen Kina. Let's see, do I see anybody? Ben Woody. I don't think I saw Ben either. Okay. Jennifer Miranda.
Good morning, everyone.
Good morning. Eric Rufa.
Yeah,
I saw him.
Hi, everybody.
Yep. Hey there. I can't see your video, but I do see you there.
Sorry, yeah.
Elizabeth Hanson. Okay. John Conant, I saw joined somewhere.
I think John may
I saw
have
his name
dropped
pop up. Okay, I saw his name come up in the queue, so maybe he'll join us again. Matthew Card, I think, cannot be with us. Oh, no.
Yeah, I'm
Someone
not sure if
said-
Matthew Cable will be here, but I'll be here.
Okay. Matthew Cable, I think, cannot. Right. Emily Brewer.
Hi, I'm here. It
Wow.
looks like it's my
For-
maiden name on there, but it's
Oh.
me.
Oh, there you are. Okay, I thought I saw your name. Everybody's so small on my screen. Sorry. Forrest, are you with us today? Don't think so. Ricky Hurley, we have Ricky.
Good morning.
Kate, are you with us? And Alice? There you are, Alice.
Here, hi.
Okay, great. And I'm going to introduce a couple city staff as well. Community Development Division Manager, Jonathan Jones.
Good morning.
Morning. And Community and Economic Development Director, Nikki Reed.
Good morning, everyone.
Good morning. Okay, I think that is everybody. And as I said in the intro, we're basically going to have this meeting run by Baker Tilly and just give us lots of information, and then we'll move into an open discussion. So if you're listening at home, we have two things on the agenda. We've already moved to item number 2, which is the HOME-ARP overview, and then we'll just have item number 3, discussion. And who is going to kick it off for Baker Tilly? Is it Elias?
Hey, good morning. Yeah, I can kick off introductions for our team.
Okay.
Yeah, my name is it's Elias Mathis. Everyone calls me Ely for short. It's great to be on the call with you all today. I'm manager on Baker Tilly's Housing and Economic Development team. We work with a lot of different public sector clients in cities around the country on a lot of federal grant programs, and have been doing quite a bit of work with the HOME-ARP program lately. And my background is in urban planning, and prior to going into consulting, I actually worked with the city of Asheville and managed the city's transit planning division. So I'm really excited to be back working with Asheville, and really looking forward to the conversation on today's call. And I will turn it over to Monique Caston, who's our project manager for the team.
Good morning, everyone. As Ely mentioned, my name is Monique Caston, work with Baker Tilly, sit in our Chicago office. Been with Baker Tilly for almost 3 years. It'll be 3 years in probably about 5 weeks, which is crazy since that's all pandemic. But I have about 16 years worth of experience working within the professional setting as it relates to grants management and affordable housing as well. So looking forward to the call today. Thank you.
Hey, my name is Daniel Giroux. I've been with Baker Tilly close to 7 months now, but my background kind of on the ground with state and local work is through workforce economic and community development. Look forward to our conversation today about Asheville and your needs as it relates to HOME-ARP. And I will pass it to Baron. I think I saw him pop on.
Yes, can you hear me, everybody? Yes, my name is Baron Bell. I'm actually with community development experts, working with the Baker Tilly team. I'm a expert in federal housing and community development programs, where I worked for the past 25 years. I worked at HUD headquarters with the policy provision and director of the Community Planning and Development Department. And I'm glad to be here as a part of our mandatory citizen participation process in administering the American Rescue Plan grant for persons who are at need of housing. Thank you.
All right. And for today's call, we want to share some of the information that we've been collecting, some of the data that we've collected from the city, as well as feedback that we've gotten from stakeholder focus groups and a public survey that we've had available for the last couple of weeks. We want to share that information, the findings that we have, and then really use today as a listening session to hear feedback from this organization as we're moving forward with developing the draft allocation plan for the HOME-ARP funding. So to kick things off, I'll turn it over to Daniel, and he can walk through a PowerPoint that we have that summarizes a little bit of how the program funds can be used and the different feedback that we've received so far.
This is my first time using Google Meet to present, so bear with me here. Let's see. I think I got it there. Can everyone see the presentation? Looks like it's loaded.
Yep, looks good.
Beautiful. Okay. Yeah, so Ailey mentioned, or as Ailey mentioned, we're going to start out by covering HOME-ARP. I know many of you know the ins and outs of HOME-ARP, or at least the HOME program, so I'm not going to belabor that very much. Discuss what we're doing to ensure that Asheville receives their HOME-ARP funding through the allocation plan that we're putting together, as well as talk about a few survey results. We can dive deeper into survey results after the presentation is over, but we wanted to kind of discuss the top 3 results there before moving forward into conversation. So first and foremost, HOME-ARP. So the Home Investment Partnership Program is an annual program from HUD. Again, like I said, many of you are probably familiar with this. It provides grants to state and local governments to create affordable housing for low-income households. And HOME-ARP is a bit of an extension of that program through the American Rescue Plan, which has allocated $5 billion across the U.S. to participating jurisdictions. If a participating jurisdiction in the U.S. was eligible for home funding in 2021, fiscal year 2021, they were eligible for a HOME-ARP funding allocation as well. And it is specific to helping individuals or households who are homeless or at risk of homelessness and other vulnerable populations by providing housing, rental assistance, supportive services, and non-congregate shelter. So Asheville, the Asheville Regional Housing Consortium allocation is almost $4.7 million. And of course, this is one-time funding. We want to make sure that's communicated when, or to keep top of mind when discussing what the funding will be used for, because it is a one-time allocation. I did not mention, if anyone has any questions along the way through this presentation, let me know, and you can come off mute. I may not be able to see I likely will not be able to see your face or anyone raising hands. So feel free to come off mute if you would like. So eligible populations or activities for HOME-ARP. The eligible populations that the funding is trying to reach or help are those that are homeless, those that are at risk of homelessness, those that are fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, or human trafficking. That includes their families. Other populations where providing supportive services or assistance would prevent the family's homelessness or would serve those at greater risk of homelessness, and also veterans and families that include a veteran that meets one of those preceding criteria. And eligible activities, what the funding can be used for, and really what we've been focused on determining through our stakeholder outreach and surveys to determine what the funding will be used for is the production or preservation of affordable housing, tenant-based rental assistance, supportive services, we'll go through that list, and then the purchase and development of non-congregate shelter.
Daniel, will this presentation be available after the meeting?
Absolutely, yeah, we can send that via email through an attachment, or we'll work with the city to determine the best course of action to get that out to you.
And the city also has a project page set up on our website, so we will add that information, add this presentation to that website.
Perfect. Thank you.
Thank you, Jonathan. So supportive services that can be covered with the funding include case management, childcare, education services, food, mental health services, outpatient health, outreach services, housing search and counseling, life skills training, assistance with moving costs, substance abuse treatment services, transportation, legal services, and employment assistance and job training. And don't think you have to fervently write all this down. We can go back and view this PowerPoint or a specific slide during our conversation as well. With the HOME-ARP allocation plan, which I discussed is really the bulk of our work, what we're holding these meetings and focus groups and gathering data to put together in coordination with the city. The allocation plan will describe proposed activities and how the participating jurisdiction intends to distribute the HOME-ARP funds, so how the money will be spent to address the needs of qualifying populations. To receive the balance of HOME-ARP funds after receiving 5% of the allocation for program admin and planning, PJs are required to submit the HOME-ARP allocation plan as an amendment to the 2021 annual action plan for HUD to review. So, and this allocation plan that has to be submitted as an amendment must be submitted by March 31st, 2023. So 2 short months away, really less than 2. And allocation plan requirements. So while putting together the draft allocation plan and allocation plan, we've got to go through the consultation process, which is what we're doing now and what we've done with stakeholders, go through public participation process. We have those dates in a couple slides for you. Completion of a needs assessment and gap analysis. We'll go over a little bit of that today as well. And HOME-ARP activities must be established. So again, what the funding will be spent on, HOME-ARP production housing goals. If funding is decided to be spent on the production of affordable housing, those housing goals must be established with saying, you know, how many units are we going to create with this funding. Preferences must be established. And HOME-ARP refinancing guidelines must be set if the funding is used for the refinancing of multifamily affordable housing. So for consultation and feedback, we gathered via virtual meetings 4 for the region, and we split these up into county meetings. Some of you were involved in those. So the first one was held on the 18th of January. This was Madison County. The second was the 19th with Henderson County, and the third and fourth were both on the 20th. And those 2 meetings were with Transylvania and Buncombe counties. A total of 51 agencies were invited to participate, and 31 individuals representing 22 agencies participated in at least 1 focus group. All of the data and comments for those meetings were consolidated into kind of an Excel sheet. And we have that today too for conversation to review and discuss what the focus groups brought up, including these 3 areas of need that were highly identified, if you will. All of those consolidated notes will be included in the ARP plan. So, you know, it'll be public. If you'd like to look at those, we can, you know, share those as well. But 3 areas of need were identified through those focus groups. The first was production and preservation of affordable housing units, and that was, you know, region-wide. Non-congregate shelter was second, and then supportive services third. The other, being TBRA, was not necessarily focused on, and I'll just go ahead and cover this. Not that TBRA is not needed, but that as of now, there isn't really any more room for TBRA vouchers when it comes to people searching for affordable housing and using those vouchers because the housing stock is so low. So we can, of course, discuss that in a bit as well. And so surveys with public participation feedback. We received 302 combined English and Spanish surveys, which is you know, fantastic. It was a great response from the community. So we're happy about that. I apologize that these are a little blurry, these survey screenshots. But when asked to rank community housing needs on the survey, and this is a ranking system between 1 through 4, construction of new affordable housing, additional emergency shelter, additional supportive services, and then housing vouchers for low to moderate income people. construction of new affordable housing was ranked as the most important, followed by additional emergency shelter. I do want to cover this really quick because this was a ranking system. So you can see the, say number one with construction of new affordable housing. The red signifies the first choice. So if someone was ranking these and they chose their first choice as construction for affordable housing, it's showing up in red here. So 43% of respondents rank construction of new and affordable housing as their first choice. 25.7% chose additional emergency shelter as their first choice. 17.9% chose additional supportive services as their first choice. And 13.2% chose housing vouchers as their first choice. If that doesn't make sense, please let me know. We can go through the rest of those. When asked to select the greatest single need for housing in the community, affordable rental housing units was ranked as the greatest need. So respondents were able to choose one of these and only one, no multiple answers available. So 167 people chose affordable rental housing as their choice. 91 chose transitional housing, and then 38 chose non-congregate emergency shelter. So affordable rental housing being, far and beyond the most important to respondents. And when residents were asked what they have observed to be the greatest gap in services or unmet needs in the community for individuals at risk of or currently experiencing homelessness, mental health services was ranked, far and beyond the greatest needs. So around 145 people, 146 chose mental health services. Employment-related services came in at 51, and then we had 40 respond as other. I went through many of those responses. If you mark other, you have the ability to, write in an answer. Most related to drug rehab, which falls under mental health, but specifically, things like drug rehab with allowance for pets. We had answers, saying that all are interconnected and important. They didn't want to choose one. That was a bulk of those other. Again, all of the things, but housing first. So, people saying all of these services are important, but I still vote housing first before these services are offered for this funding. And then comprehensive support services. So again, all of these services are needed, but that was the bulk of the other there. Okay, so those are the 3 survey questions we wanted to cover. And again, we can go over those in more detail later if you would like. At this time, I am going to pass these next 2 slides to Barron to discuss the point in time counts.
Thank you, Daniel. Okay, so what we see here are the point in time survey counts. Jurisdictions that receive funds from federal housing and community development programs are asked to do a point in time 1-day survey, which is generally in January, to determine the number of homeless persons on that day that are either sheltered or unsheltered. So the results that we have here is for the point in time count that was done in January of 2022. There also was one done in January 2023, maybe just a few days ago. So that data is not yet tabulated yet. So this is the most current data that we have for the Asheville Continuum of Care region, which includes Montgomery County. So what we have here, emergency shelters on the point of time survey, we had, for example, in the left corner there, 10 units having 28 beds for families. That's with children under the age of 18. And then we had adult beds, which were just single beds in congregate housing, 176 beds available with 5 veterans residing in those beds. Then the next below housing type is transitional housing, where we had 54 families in 19 units. For adults only, 213 beds. So emergency shelter and transitional housing, persons who are residing in either one of those 2 are determined to be homeless individuals. So emergency shelter, we're trying to get people off of the street. The stay is generally limited to like a 60-day period. And then we try to get people into transitional housing, which generally is a 24-month, 2-year housing arrangement with supports to try to get the people to a more permanent housing solution. So that next one is permanent supportive housing, which is also a publicly assisted housing option that provides for persons supportive housing. Generally, it might be somebody that lives on site. There's some sort of, care and follow up with these persons who are determined that they cannot live independently without these supports. And then you have other types of permanent housing. So that's the current inventory that we had in the point of time survey. And you kind of focus in on the middle, we have our homeless population. So again, homeless are people who are living in a situation that's not designed for a permanent housing. And we have two types, sheltered and the unsheltered homeless. So the sheltered homeless, those are our families that you see below. And then we have our sheltered and unsheltered homeless. So we can see from this point in time survey that we had 570 some odd households, adults without children, who were enumerated as even in a shelter or unsheltered during the point in time survey. So that category of persons would be our greatest need according to the data available in the COC. Then we have at the end of that column, the gap analysis we have to be announced or to be determined that should be, and this is what we're doing with the process. Sometimes the data that we have doesn't tell the complete story, and this is why we have to have citizen participation and consultations with stakeholders to really try to come up with a gap in services, which again, it's not a fixed thing, it's more so of an art, if you will, where we're taking data and also with our consultations to determine, what the gaps are. And so that's why that's blank, because we're still in the process of determining that. All right, and we go to the next slide that we have here. So again, this is the continuum of care. Now we also have the balance of state continuum, and these are what these numbers show. So we have Henderson, Madison, and Transylvania. According to the number of households we had in those three counties were 20 and totaling 66 persons. And then you see in this chart here the types of housing situations. An important takeaway is that emergency shelter, we had 44 persons in the emergency shelter. For Henderson, 16 for Madison, and 33 for Transylvania. So that's 93 in emergency housing. And then we had 3 for residing in transitional housing, which generally, again, these numbers, with it only being 3, it might not indicate that there's not a need for transitional housing. It could also indicate that there's not enough services within those 3 counties for transitional housing. So all of this information takes collaboration, again, consultation, input, feedback from citizens, and the government's there to determine the best use of the ARP funds. All right. So those are those 2 slides there. Now, allow me to mention here, Daniel, that the ARP funds are not just for persons who are homeless. And you saw that our #1 survey use of funds is production of affordable housing units. So in addition to persons who are homeless, ARP funds also can be used for households that are at risk of homelessness. So you can have an understanding of what that is. A household that is at risk of homelessness is a household that has an income that's 30% and below the area median income. So for 2022 in the Asheville metro region, for a 1-person household, 30% of the area median income is $16,900 annually. For a family of 4, an extremely low income household would be $24,100. So that's a year, to give you an understanding of real numbers. So in addition to those income levels, if we have persons who don't have support networks, they're living in a hotel, motel that they're paying for out of their pocket, or they have they receive a notice that they must leave their current housing situation within like 20 days of filing for an application, or they live in some sort of congregate housing where there's more than 1.5 persons per room. Those are some of the other conditions that can designate a person as, or household as, at risk of homelessness. Then also we can provide services to persons who are what's called under the grant at greatest risk of housing instability. So those at greater risk of housing instability, they have some of the similar income, other social conditions as those at risk of homelessness. The big difference is those individuals' incomes can be up to 50% and below the median area income. So for an example, again, for the Asheville area, for a one-person household, that 50% limit, which is called very low income, is $28,150,000 a year. And for a family of four, that amount goes up to $40,150 a year. So in addition to the homelessness, those are the main categories that we have. Persons who are at risk of homeless, and then persons who are at greater risk of housing instability. And also, if you recall from our slide, we have individuals who are fleeing domestic violence or domestic stalking is a target group, which is not so much about their incomes, but about that condition of them being victims of domestic violence. And then within several of these population groups, we can serve veterans, but veterans in and of itself is not a category. But if we have vets that have some of these other conditions, then they can receive preference for housing under the grant. So I will yield that. And is it back to you, Daniel?
Yes, thank you, Baron. We're just about to wrap up. Let's see if I can get this one. Yeah, and so next we just wanted to discuss important dates before we get into the conversation topics. So the draft plan will be presented to you guys at ARHC on March 6th, 2023. The public comment period that I mentioned that's required throughout the allocation plan process is going to be from March 6th to March 20th. The public hearing, which will be held at the city council meeting, will be done on March the 14th. And then the presentation for final approval will be March the 28th. And as mentioned earlier, the plan must be submitted to HUD by March 31st. So we'll be moving fairly quickly over the next 2 months to get this plan completed and presented for final approval. And that is it for the presentation. Before we get into discussion, are there any questions about HOME-ARP? Any of the items that were discussed during the presentation? Any questions specific for Baron on the intricacies of the funding? We can answer those now before we get started. And of course, have availability to answer those throughout.
Anybody have any questions? I think my screen just froze. Nikki, go ahead.
I'll ask a question that's just for our general awareness. So the plan requires that we designate the types of projects that we want to pursue. It doesn't necessarily mean we need to award it to particular nonprofits to carry out the work. Is that right? Can you just share a little bit about exactly what you're aiming toward with the plan itself?
Yes, that is absolutely correct. The purpose of the plan is to say what types of housing or supportive service activities will be funded and for which eligible population groups. But we do not have to designate in the plan one specific site, location, or developer who might do an actual project. That's not a requirement of the plan.
Thanks for clarifying that, Nikki and Baron.
Sure.
Any others? I feel like we've talked about this program and these future allocations at good length, so we hopefully all have a pretty good grasp on what the uses can be, what we've just listened to here today. How can we best support you all in your next steps? What do you need to hear from us if we like this, if we wish something is there?
Yeah, and the purpose of today's call, we're just coming out of the consultation process, and we're still in the beginning stages of developing a draft allocation plan. So what we wanted to accomplish today was really present this information to you all and hear from you. Again, use it more as a listening session to see what your thoughts are on the data, and get your opinions and thoughts about eligible uses for the funding. And, we can drill down in more detail on specific data points that we've collected or, information that we've received. But again, more than anything, it's hearing from you all about what the priorities are based on these responses.
Could you possibly go back to the page that shows the participants, the 51 people, some like 31 participants from each 22 groups, and tell us a little bit about the stakeholders that you chose for this? If we're going to lean so much on the data, we might need to know, how big was the crowd? And yeah, could you give us some examples of agencies that participated? Were they throughout Buncombe, all counties?
Yes, sorry, one moment. I'm just trying to pull up the focus group Excel. And what I'll do, I'll go ahead and share this Excel, which highlights the agencies and their feedback. So I guess I'll have to stop presenting. Okay, so this Excel sheet is really a layout of what you will see in the HOME-ARP allocation draft plan that will be submitted. So it includes all the organizations consulted, the type of organization as required by HUD. We are required to meet a certain type of organizations that serves people that are homeless, veteran populations, elderly populations, youth. So we did hit all those marks through the consultation process. The method of consultation, so how we met with them, most was virtual meetings, some was via phone call, and we received some additional follow-up comments after the focus groups, and then just kind of highlighting feedback here. This is not dispersed into separate counties. It's just, all in one as HUD requires. But the organizations consulted are just down these left side. So the Salvation Army, Hot Springs, that's Madison, Only Hope, Thrive for Health, Safe Light, Henderson County Planning, City of Hendersonville, ARA Home Women Vets, Transylvania County, Habitat for Humanity, Transylvania County, Sharing House, the Haven of Transylvania County, City of Brevard, Housing Assistance Corporation, Pittsville Legal, Homeward Bound, Asheville Housing Authority, WNC Bridge, again, Pittsville Legal, so separate counties, Sunrise, Via Health, Buncombe County Planning and Development, Community Housing Coalition of Madison County, Madison County Housing Authority, Haywood Pathways Center, and Blue Ridge Health. So that's who all we received feedback from focus groups or email or phone conversations. And we, of course, also have the stakeholder responses from the stakeholder survey. So separate and apart from the community survey that was sent, we had the stakeholder survey go out and it went to the full list of stakeholders that we received, which included the COC and any COC agencies and any agencies that provide these type services to the community.
I'm glad you mentioned that, Daniel. I did want to call that out too. With the stakeholder survey, we received 34 responses to that. So, and that's in addition to people that were able to attend the focus group meetings. And I would say the results of that were fairly similar to what we were hearing in the meetings. And a couple of points really stood out to me from that. When asked about, the greatest issues in the community, 91% selected lack of affordable rental housing is the top issue. And a similar question related to the highest priority for this funding, 79% of stakeholders identified development of more affordable housing as their priority. Those were just two questions that, really jumped out. Typically, when we've done this, we don't see such clear results, but it seems there's definitely a lot of interest in looking at either transitional housing or long-term housing solutions. It looked like Emily raised her hand.
Yes, I did. This is Emily with the City of Brevard. I can't speak to all of the other focus groups, but I really appreciate the fact that it was such a robust conversation and we had such a good group in the Transylvania County focus group in particular. I thought it was really a beneficial call, not only for this process, but for all of us. So I wanted to say thank you for facilitating that discussion and being able to help us with that. But I also wanted to say it's very interesting to me that the top 3 priorities from our discussion are the same across the board with all these other counties. And so I think that's reassuring that we're moving in the right direction with this allocation plan to hear that a lot of the feedback is pretty consistent. So thank you.
Yeah, I think that's a really interesting point. When we started this process and the way we set the meetings up based on different geographies, I was actually expecting to see pretty significant differences in the responses that we got. But really across the board, we were hearing kind of the same issues coming through and the same priorities. So that was definitely surprising.
And I'll chime in here just for a minute to say, like, part of the strategy as we, as the city worked with Baker Tilly to, develop those focus groups was to, make opportunities for the different communities, the different counties to provide that feedback, but then also to use this meeting as an opportunity for the consortium itself to provide feedback, observations, thoughts, because we've got the general public that we are going to be reaching out to, or that we've been reaching out to with the surveys. We've talked to specific stakeholders, but then we also wanted to provide the consortium with sort of an opportunity for the same kind of robust discussion that Emily's talking about occurred in some of the individual focus groups. So sort of tying that all together earlier in the process, rather than compiling all of that information and then sharing it later in the development of the plan. So hopefully this is that opportunity for you all to weigh in on thoughts and what you're seeing in your individual communities.
Thank you, Jonathan. Any other thoughts or questions for Baker Tilly or city staff at this point? Okay, well, I appreciate seeing the list of organizations and this amount of feedback. I think it's going to be helpful in understanding that we've had a pretty broad reach throughout the region. I don't have any more questions myself. I suppose we could wrap it up if everybody else has had all of their questions answered. I know we haven't necessarily roll calls to make sure that they are added to the minutes properly. And go ahead, Nikki.
If we are in the place of wrapping up, I just wanted to start talking about next steps, because I think it was great to see from Baker Tilly what we anticipate as far as next steps for meeting that HUD deadline. So you all are seeing that there'll be a meeting convened of this group later on to then hear that draft allocation plan, and then proceeding as part of the process through a public comment period, which will begin in March 6th. And then a public hearing at City Council, so as the PJ for the Home Consortium region, that will go through the Asheville City Council process to host the public hearing on March 14th, and then have that presentation of the final plan on March 28th, which of course gets us right on time for that March 31st plan allocation submission to HUD. So we're excited about these next steps in the coming weeks. I did want to take a moment to highlight new staff that we have onboarded. I don't know if this team has met Miranda Masters yet. And so Miranda is virtually on the screen there. Miranda is our official HOME-ARP staff member who is helping to work with Baker Tilly and is helping to guide us through this process. And then she will also be instrumental then after the plan is submitted to HUD, then seeing how these dollars then make it into the community, right? So once that plan has been accepted by HUD, Miranda will be on point for assisting in the process through this body that will then look at the disbursement of those funds to support the projects that are identified and congruent with the home allocation plan. So we're excited to have Miranda. I did want to take the opportunity with this group to also share some unfortunate news in that Jonathan Jones has accepted a position with Buncombe County. So we're glad that he is able to continue to serve our local area, but it will be big shoes to fill in terms of the administration of our community development division here for the city of Asheville. But he may actually appear on this screen just wearing a different hat later on. So, but any final thoughts, Jonathan? I know we've certainly appreciated your leadership here, and you've accomplished a lot in your tenure as the community development division manager. And so I see Karen has raised her hand, so go ahead, Karen.
I just have a quick question, and thank you all. This has been an amazing presentation. Just like Emily stated, by chance, and I just think because we are a consortium and we serve the bigger area than the city of Asheville, will this be presented to the 3 county boards prior to the city of Asheville's council moving forward and voting on this?
So
go ahead, John.
Yeah, so at this point, we haven't scheduled any presentations to local committees, and have been, as we've done with all of our previous home funding decisions and policy decisions, have used this body as that opportunity to review, to update and approve those decisions for the community. So as a representative of your community, that this would be the opportunity to help make those decisions.
Jonathan, congratulations, but also, dang it.
I would also like to add briefly, because I think it was you, Sage, you had a question earlier about what needs to be included in the plan in terms of identifying projects. Although we do not have to identify any projects, we do have to identify in the plan when you're going to do affordable housing development by either new construction, acquisition, or rehabilitation. We need to include in the plan an estimated number of units that will be produced with the funds. So that will require some folks locally to do some sort of pro forma analysis based upon some good market information to come up with an estimate in that. Also, bear in mind, and many persons don't do this when they're looking at the survey, the income levels for these ARP funds are very low, which means there's not going to be a lot of money or the same sort of funds being generated from the rents to pay the debt service. So generally with affordable housing, if that's where the funds are going to be designated towards, politically, we have to have understanding or some idea most often of a low-income housing tax credit use or some other, project that's out there that these home funds, might be used to subsidize as a, to help, make units, more affordable. But we do have to have a calculation in the plan.
And it looks like maybe Sage is having some connection issues, but I see that John Connett has his hand up.
Yeah, thank you, John. Thank you.
Yeah, thank you, Sage and John. This is John Connor. I'm the city manager in Hendersonville. Just want to follow up with what the question Karen asked. I think since we're all very much aligned in what our needs are, it would be nice, and I know you said you're going to send out the presentations, if our independent representatives with the jurisdictions, the partners, the local governments presented to our governing boards as part of this to share this information. I think that would be helpful because it is a topic that is being discussed among all. I don't want to speak for all governing boards. I know in Hendersonville we discuss it on a regular basis, and the fact that we're trying to work together as a regional consortium would be helpful, and maybe we'll get some press out of it that we're trying to work. And everybody needs to realize this is a regional issue, just not a Asheville Buncombe County issue. So I think if we can get those documents and have contact folks that we can call if we have questions, as we may want to make the presentations to our respective governing boards, that would be very helpful. So I would appreciate that very much.
John, this is Karen. I very much support that idea.
Yeah, that's a great idea. Makes sense. Any other thoughts or questions from folks today? I am having a little connection issue, so I'm keeping my video off. And we have some time left on the calendar, or we can also wrap it up. And maybe we want to flash that timeline one last time for those that have been listening at home. And I believe March 31st is the next one. It comes to council in February. No, in March.
So on the timeline, the next step for this body will be the March 6th meeting. And you all should have received a poll as far as scheduling a specific time on that March 6th date. We are really, as you can see, working backwards from the March 31st deadline that HUD graced us with. We had to build our timeline working backwards from some of our public comment periods and when we could get city council approval, because that body has to make the final approval for staff to submit the plan to HUD. That puts us at March 6th as the next opportunity for this body to meet and hear the final presentation and recommendations that would be submitted to HUD for approval. So if you all can take a moment and identify some time that would work on March 6th, we will need to have a vote as part of that meeting. So we will need a quorum for that meeting. So if we can make that happen, that will launch us into the next phase of getting this plan in place.
Ron, I hear you asking for us to possibly set that today, but there are so many folks that couldn't join. I wonder if we might need to do an email. That creates back and forth, but
sorry, Sage, I'm having a hard time hearing your suggestion.
oh, I'm sorry, I didn't realize. I was just thinking that we need to get input from folks that are also not available to attend today.
Okay, yes. So I think what we can do is, because we're recording this presentation, we can make sure and share the link to that recording on the website. And then if folks need to follow up, Miranda will be our point of contact for the HOME-ARP process. So scheduling some time to meet with her. And if we need to put some more time on the calendar with our friends at Baker Tilly, we can do that as well. Just to make sure that we got the opportunity to gather that feedback and incorporate that into our process. Most definitely. I think that makes sense. All right. I sounds like Sage may still be working through some technical issues on her end. So any other questions or thoughts related to process, next steps?
Hi, sorry, I switched to a different device. You should be able to hear me now.
Yes.
Yeah, it just sounds like we're wrapping up. I was able to hear you, so thank you for chiming in there, Jonathan. And I do think we're able to wrap if there are no other questions. Last call for questions. Okay, for those of you listening at home, you can see our calendar posted. What I was suggesting, I think you had a hard time hearing me, Jonathan, is that we make sure to reach out to the folks that couldn't be here today, both so they know to watch this and get their update, but also so we get their input on this next meeting. I'd hate for them to be left out twice.
And I just realized we had also included on the agenda the possibility of any public comments. So I wanted to make sure before we break that we do have that available just as part of our regular public meeting procedures. I don't know if we've got anybody on the line.
There are no public comments currently.
All right.
Okay. Well, that does it, everyone. We appreciate your time today. Thank you, Baker Tilly and team, for being here today and for sharing the presentation with us. I suppose if you need anything from us in between now and the next time we meet, just reach out to the city staff and we'll get what you need. Ely, good to see you. And thanks, everyone. With that, we are adjourned.
Thank you very much.
Thank you.
Thank you all. Have a great rest of your day.
Thank you.